So we looked at cryoglobulins in patients with IgM disorders. So cryoglobulins are proteins, they're antibody proteins that precipitate at cold temperatures. And in the laboratory, these can be reheated and they redissolve. And it's a type of phenomenon that can be seen in a number of different conditions. And there are a number of types of cryoglobulins. You have type 1, type 2, and type 3. But in patients with IgM disorders, type 1 and type 2 can be seen. And we know that patients with WM or IgM MGUS, or less commonly non-Hodgkin lymphoma, can have a circulating IgM, and some of these can perform and cause a cryoglobulin. So this is a rare condition, and IgM-related disorders are quite rare as well. So there's not really been good studies or good literature looking at cryoglobulins systematically in patients with IgM-related disorders. So we looked at in the UK as well as in the Netherlands, large referral centres to see what the prevalence or how common it is to have a cryoglobulin in patients with an IgM-related problem. So this is looked at over a large period of time, so 2013 to 2022, and 534 patients were screened. So these are patients with WM or IgM MGUS or an IgM-related non-Hodgkin lymphoma, and they were tested for cryoglobulins. And of those, about a quarter of patients had a type 1 cryoglobulin. And around half of these were symptomatic, so they had problems related to the cryoglobulin, and around a half were asymptomatic, so they didn't have any problems related to the cryoglobulin. What was really interesting was to see that in patients who had the cryoglobulin, around 20% of those had problems with their skin or cold intolerance. Some had color changes in the skin. Some had, at the extreme end, ischemia or gangrene and ulceration in the skin. Other symptoms that were quite common included complaints of neuropathy. A smaller proportion, around 10%, had complaints of hyperviscosity, and less than 10% had joint aches and pains. So there's really a wide range of symptoms that can present. In this cohort, there wasn't patients with liver or heart problems related to cryoglobulins, and those are probably much rarer. It's really interesting to know also that other rarer conditions like cold agglutinin disease can also be seen in patients with cryoglobulins. So this is something that can affect the peripheries, the cold symptoms, the hands, the feet in different ways. Of these, a proportion of patients needed treatment, but not all patients with cryoglobulins needed treatment. So I think to summarize, this study looked at patients with IgM-related disorders, and of these, around a quarter had a cryoglobulin, which was type 1. But not all of these patients had symptoms related to it, and not all of these patients needed treatment. But there are a number of different symptoms that patients can present with that are important to look out for. Thank you.